teams, Lauren here with Bizrok. In this week's video, I want to talk to you about the 333 follow-up system, and specifically following up with patients who have either called and as a new patient and didn't schedule, or patients who came in and treatment was presented and for whatever reason they didn't move forward with that day. Now, for some of you guys, here's what I know is already going through your mind. You're like, Lauren, I don't want to be a bother to somebody. I don't want to, over call or over text or over email patients. But guys, here's what I'll tell you whenever I go through this system. Your patients, much like you, are busy. Guys, we're all busy and we have things outside of the dental practice where we're not thinking about some of our follow-ups or thinking that, oh yeah, Dr. So-and-so told me that I needed to move forward with a crown, a root canal. The reality is, unless it's hurting or unless there was enough urgency created when that patient was physically in our office, once they're out our door, they totally forget about it. So until it's hurting or until they come back to see us, it's not at the top of mind. And so whenever we're following up with our patients, guys, it's because it is our duty to serve our patients and to re-educate them and get them taken care of. Now, for your practice, I am going to assume that you have a conservative doctor who is presenting treatment to patients that they truly do need, or a patient has maybe a cosmetic case that they just want to have. And so you have one of those things to fall back on, okay? So what we love to teach is something called a 333 system. That is 3 text messages, 3 emails, and 3 phone calls. Now guys, I know that especially some of the younger generations, you love to just text and like email's a thing of the past, and we definitely don't do phone calls, right? Guys, we should be doing phone calls in our practice, okay? So with the 333 system, it is rotating through how you're communicating to your patients. And guys, I want you to write this down. This is actually over a 9-week time frame, okay? So that's a long time, right? And that is 1 touch point per week. So that doesn't mean that you're doing all 3 of those things on one day, okay? So week 1, you might phone call the patient. So you leave a message with the patient and they don't answer, you leave a voicemail, you make a note, move on. Week 2, maybe week 2, you send them an email. Week 3, maybe you do a text message. And then week 4, you repeat the cycle until you have gotten to either 9 full weeks of touch points, or the patient answers and says, hey, I'm really just not ready to move forward with that. I'll talk about it at my next appointment, or yeah, I'm just not going to do that. We want to be respectful and stop following up with them, okay? All we can do is educate our patients, make notes of it, and move on, okay? So that 333 system allows for a few different things. Guys, it allows us to be top of mind for the patient. Maybe they didn't see the first text message. Maybe they actually don't answer their emails at all or even look at them. And so they never even saw that. And maybe a phone call came through while they were on vacation. They're like, oh yeah, I need to follow up with them. Guys, there's a study out there that over 80% of all patients or people move forward with something or someone after the 5th touch point. Guys, that's crazy. Specifically, the stat is between 5 and 12 times will somebody finally move forward. So guys, I don't want you to tell yourself a story and say, I don't want to bother my patient so much, or I feel like I'm harassing them. Guys, if you're stretching it out over a period of time and you're changing how you communicate to patients, you're not harassing them. You are serving them. Again, your patient has a need, your doctor treatment plan, something. And guys, if there's a root canal, if there's a filling that they need, or a crown, guys, the reality is they do have an infection in their mouth, right? And so it's our job to serve them and to get them back to full health. If your patient came in and maybe they have a cosmetic need, all right, that's a little different, but they still said that, hey, I'm interested in doing something because I've got a wedding to go to soon, or I've got a big trip, or I want a new promotion, whatever it is for the patient. I just want it because it makes me happy. Whatever your patient's needs are, you want to fall back on that and then use that verbiage to educate the patient. So as you're following up with your patients and doing the system, guys, please don't skip over what I had said earlier, which was, if your patient on the 4th time you reach out to them, they finally answer and say, hey, I'm good, I'm just going to wait for now, please take them out of your follow-up system, okay? You don't want to upset patients because then that is harassing them. Outside of that, you are serving your patients and you are communicating to them and you are trying to get them taken care of. So do me a favor, as you start your week this week, or maybe you're towards the end of the week, whatever it is for you, start it and try it. Our recommendation is always that you at least try something with about 20 patients and document it, guys. Reach out to 20 different patients who have unscheduled treatment. Find this process. Do a phone call, text, email, or reverse it. But find a process that works for you. Track it and see at what point do patients call you back and either move forward or say, hey, thanks, but no thanks. That way you can adjust for your practice. If you need help with verbiage or guidance, guys, reach out to us. Otherwise, you've got this, and we can't wait to see you and serve you soon.